Hey, this is Tim Ashe, President of the Vermont State Senate. It is Friday, May 1st, 2020. Here with my nightly update on Vermont's response to the COVID-19 pandemic. Yesterday, I had a brief reference to T.S. Eliot's classic poem, The Wasteland, which began with "April is the cruelest month." And I have hoped, and I think we all hope, that May will bring better days. And time will tell, but I think that our collective efforts are making it more likely that May will be a much brighter month than April was. I do want to say that one of the strange features of this pandemic is that we all remember the curve that is typical of COVID, which begins slowly and then suddenly starts to spike, which we had in Vermont, thankfully not with the numbers that other communities have had. But now that we're testing more people, it's likely we'll actually start seeing a slight uptick in the number of people who test positive for COVID-19. So just today, we had 16 positive tests, new positive cases, which is much higher than we've been seeing in recent days, where maybe it was 2 or 3 or 4. And so as the testing program expands, it's likely that we will see more positive tests come in. But in general, the trends right now for our public health measures are going in the right direction. So I do want to say we've reached, it's really one of the problems with numbers when you assess a public health crisis like this is you treat bars on a graph and the total numbers rather coldly and clinically, almost academically. And we've now had 50 people who have died who had been infected with COVID-19. And I always have to remind myself, and I think it's worth saying out loud, that we have to care as much about the 50th person as we did about the first one, even though our fatigue with COVID-19 and all the things that it's changed in our lives makes it hard sometimes to continue to feel the same emotions for the 50th case versus the first one. So just something we all have to remind ourselves, because somewhere someone's family of the 50th person who passed away with COVID-19 is going through the same emotions and difficult times that the first case back a month and a half ago did. I'm going to talk really about I'm going to focus really on the testing issue just in some preliminary comments here. And then I'm going to talk about a bill that the Senate passed today related to COVID-19, and then wish you a good weekend after that. So today we had on an all Senate call, and I do encourage people to, maybe it's not part of your normal lives, but go to the legislative website from time to time and look at the meetings that are upcoming. And you'll often find that there are things that might be of interest to you that you didn't anticipate the legislature would be taking up. And all of our meetings now are able to be watched in real time, usually through a YouTube link. So today at 2:30, a full complement of the Senate was on Zoom, and people were watching on YouTube with the Commissioner of Health, Mark Levine. And the specific issue we wanted to talk to him about was the more aggressive amount of testing that he has signaled we will be doing in Vermont, what that might look like, what we should expect as citizens of the state and visitors of the state, and so on. And before he really got into the specifics in terms of testing, he did mention that right now we are still under a number of public health orders from the governor, which should dictate the way we proceed. For instance, if someone returns to Vermont from, say, Florida or North Carolina or some of the states where many Vermonters spend parts or all of the winter, when they come back, the public health order that is in place right now and that has effectively the force of law is that people have to self-isolate for 14 days. So while we will continue to do more testing, until those stay-at-home order restrictions are lifted, people do have to continue to operate under the same framework that we've had for the last 7 or so weeks. So to put things in perspective about what the new plan is for the state of Vermont moving forward, as we see how we can safely ease the restrictions we're under, it's worth noting that today, or as of today, we are, as a state, performing about 1,000 COVID-19 tests a week. The Commissioner of Health told us today that within short order, the goal is to have 1,000 tests being performed a day, so 7,000 a week instead of 1,000. Obviously, a huge jump. The Commissioner believes that that's made possible by an increase in all of the supply chain items that are required for testing. There's chemical agents, there's the devices themselves, there's the testing equipment on the back end, and the Commissioner believes that we're now well positioned to significantly increase the amount of testing. The reason that's so important is as the governor makes certain restrictions, as he uses this term about turning the spigot, to allow more people to resume their normal activities, using a more aggressive level of testing is really important, because if there is a positive test somewhere out there, it'll allow us to immediately isolate that particular instance so it doesn't turn into an outbreak. I think we've seen in other states, but also here in Vermont, where we've had three facility-based outbreaks where one person begins to infect many others, and the consequences are extremely dire. I'm thinking of Burlington Health and Rehab and Birchwood Terrace, both in Burlington, and also the prison in St. Albans or in Swanton. So the reason for all the testing is to make sure that we can drill down to the site of one particular person who might be infected before that person has the chance to infect many others. The way this will roll out now is that in some cases, entire facilities, especially health facilities, certain educational facilities, childcare facilities, there will be very regular and comprehensive testing that goes on, so that when there are many people, I should say, congregating in one particular place, that the testing is happening with a frequency to catch this dormant period before COVID-19 symptoms start emerging, which is about a 14-day window. So the details are, I'll confess, some of them are a bit over my, above my capacity to appreciate the full complexity. But in order for what we come to expect as life in Vermont to start resuming normalcy, or some semblance of it, it's going to require a much more aggressive testing program. The plan right now is not to be at any point testing every single Vermonter, but instead to focus on these prioritized groups. The governor today did allow, beginning on Monday, May 4th, so this coming Monday, an increased number of people to work in particular job sites. So an example would be small manufacturing or small construction projects where for this week, up to 5-person crews have been allowed to be on a particular site. That's going to go up to 10, still required to follow the social distancing rules, required to wear a mask, and now with this movement up to 10, required to have specialized training on the health impacts and warning signs of COVID-19, and having a health officer, if you will, for each workplace. Some manufacturing facilities are allowed to increase beyond 10 on a case-by-case basis, but have to ensure that they will be following a very strict set of processes to reduce the risk of infection. So it will be a gradual process of allowing more and more activity, and the testing that comes with it is really critical. So I think I've said enough there. So now I want to turn to something that the Senate passed today. So the Senate has been, as has the House in Vermont, focusing exclusively on what we call COVID-19 related legislation. We have made it safer to conduct elections over in the coming weeks and months, to reduce the chances that people become infected because they're carrying out their democratic duties of voting and participating in the political process. We've made things flexible for healthcare providers to get through this crisis, and a variety of other pieces of legislation that I've talked about in previous updates. Today, we took on an element of the COVID-19 crisis, which I've talked about at some length over the course of the last 7 or 8 weeks. And I'm very proud that the Senate today was able to pass legislation to address it. About a month ago, I mentioned to those who watched my updates that we were very concerned with a couple unintended consequences of federal legislation, primarily being that for some people who work in relatively high-risk situations and who don't make a tremendous amount of money, their contemporaries or peers who may be eligible to be on unemployment, say because they have a child who is home with school closure, that person could very easily, by being home, receive more from the new federal unemployment benefit program than they would if they were at work. Now, we're not pointing fingers at the individual who stays home to care for a kid, but the issue is for the coworker who remains in the workplace, who is now actually making less money by working than peers who are staying at home. It's made more unsettling by the fact that many of the people in these jobs that were considered so essential that they had to keep operating, that the risk factor, the elevated risk of infection for those individuals is much greater. So not only are they seeing pay that doesn't compare to those who are not working, but then they're also in this heightened risk. And so I had mentioned that I created a work group of 4 senators to start trying to figure out how we might come up with a Vermont proposal to partially address the economic inequity that was created and recognize the, in some cases, very hazardous work being done by these employees and make sure that there was some monetary recognition of that. Well, like many things in the legislative arena, it did not happen overnight. It has been about 4 weeks. We have been reaching out to the governor's team. We've been reaching out to our House counterparts, trying to keep them up to date with the information that we've been producing in terms of estimates of cost, what type of employees should be eligible, who maybe shouldn't be eligible because they can find resources elsewhere. And at a certain point, that work group transitioned their work to the Senate's Appropriations Committee, which typically writes the budget. And that committee, the Appropriations Committee, started working on it and making some tweaks and changes. So after all that work, today the Senate took up what it's called an Essential Employee Hazard Grant Program. I don't care what you call it, as long as you know what the point is, which is to make sure the people who are in higher risk positions that don't pay a lot get a little bit of a paycheck boost. That's the core of what the bill is. So I'm going to talk a little bit about who is envisioned to be eligible for these grants, what it looks like. I won't go into gory details, and I would welcome people to ask questions by email or on Facebook, and I can provide a little bit more clarity than I'll be able to do verbally in a one-shot unscripted approach like this. But let me start by saying the employees who are covered for this hazard pay grant in the legislation. And I have to start by saying the legislation passed the Senate today. It still has to go to the House, and after it goes to the House and we work out any differences, it goes to the governor, who has to make a decision. The governor has not been clear about whether he'll support this or not. So to be eligible for the grant program that we've established today, the employee would have to work in one of the following settings: grocery, pharmacy, some retailers who have been deemed essential under the governor's stay-at-home order, people who do delivery and distribution, trash collection, waste management, janitorial, people who work in assisted living facilities, nursing homes, residential care homes, therapeutic community residences, healthcare facilities like doctor's offices, vocational rehabilitation workplaces, dental offices, home health agencies, homeless shelters, federally qualified health centers, which in Burlington is the Community Health Center of Burlington, but there are federally qualified health centers all throughout the state, including at Gifford and Cheslow in Lamoille County, attached to Rutland Regional Medical Center in the Rutland area, and there's a number of others as well. Clinics for the uninsured, rural health clinics, Department of Children and Families, residential treatment facilities, people who work for private or nonprofit ambulance and first responder entities, people who work at funeral homes or in crematorium, and then people who work for organizations that serve vulnerable populations, which might include community action agencies that run everything from food shelves to getting a warm place to stay for people at night. So those are the types of place of employment that employees might be eligible for. But just working for one of those organizations or employers is not sufficient. For instance, if you're the CPA for a grocery store chain and you've been working remotely the whole time, you have not been at elevated risk. So this is not, it would not be appropriate to put hazard pay grants in that person's paycheck. In order to work for one of those types of employers and be eligible for the grants that have been passed by the Senate, one of the four following things has to be true about the specific work assignment for the individual employee. First, you have to provide in-person services to members of the public or to clients. So in person, not over a computer screen, not by the phone, but you provide in-person services to members of the public. That you clean or sanitize premises which are open to the general public. So you may clean the floors or bathrooms or any other part of a place where members of the public are continuing to be allowed to enter. You stock products and shelve products in areas that are open to the general public. If you work at a grocery store and what your task is replenishing the supplies on the shelves, that's obviously a place where many people from the general public are coming into contact with the space, the shelves themselves, some of the products. So that would be eligible. And then we've created a bit of a catch-all, which gives some flexibility to the executive branch, which is basically any other activity for one of those employers that presents a bit of additional risk. So that's the who would be eligible. What they're eligible for is probably the most critical thing for many of them. For anyone who works, I believe, more than 108 hours over a 1 month period, they would be receiving a $1,000 cash grant for up to 2 months. So more than 108 hours over a 1 month period. For anyone who works between 34 and 108 hours, it would be $600 cash grant for up to 2 months. So up to $2,000 for someone who effectively works full-time, and up to $1,200 for someone who is essentially working part-time in any of these particular positions. The universe of people who we project this covers is about 33,500. 27,900 we estimate are in all of the non-nursing home and non-home healthcare positions that I described on that list. And then the remaining 5,600 are nursing home and home health positions. So it's a lot of what sounds like technical detail, but I want to maybe conclude talking about it by getting to the heart and soul of what the whole point of this is. We now use the term essential worker or essential employee or frontline worker. These are terms that have been amplified during COVID-19. When people typically in a time of crisis think of frontline workers or essential workers, they usually think of first responders, police, fire, people who work in hospitals, all of whom truly are essential and frontline and deserve our gratitude, immense amounts of gratitude. But what COVID-19 has really exposed is the number of additional job categories that are also essential but are usually treated more or less as an afterthought, as if they're invisible, they're underappreciated, undervalued. But we know that things would come crumbling down around us right now if it weren't for these people performing these job duties. And so today's legislation really originated with a basic appreciation and recognition of people who are in unglamorous positions, who really deserve more than just a thank you, but deserve to be acknowledged for the extra risks they've taken, the stress they've been under showing up every day. And you can all remember in those first days of mid-March and heading into April, people were perhaps even more acutely concerned than they are today, even though people are still concerned. And so this legislation is really born of a recognition that those individuals that I've just described usually get the short end of everything. And it's about time that someone stood up to support them and recognize the really valuable and honorable work they do. And it's one of the reasons I'm so glad that the vote today was 28-0, a unanimous roll call vote on a really significant program. We expect to use some of the federal money that has come to the state. You may have heard we received a $1.25 billion chunk of money from the feds to help support us through this COVID-19 process. And that's the source of funds we hope to use if we can get this to the finish line. So I want to thank all of the people who are performing these essential functions, all of the people who encouraged the Senate to keep at it and trying to find an approach that would work. I'm very hopeful that our counterparts in the House will take it up, and they might make adjustments and changes, and that's totally appropriate. But the sooner we can get this to the finish line and get it to the governor's desk, it means that people will receive this monetary grant and recognition of their work in the short term, and not something that shows up a year from now, hopefully long after we've started to resume normalcy. So on that note, I want to wish everybody a good weekend. I'll be back on Monday, and hope people continue to stay safe. And the weather's supposed to be beautiful, but that doesn't mean that the public health orders and our Commissioner of Health are telling us not to wear masks. He's still saying we should be wearing them, and we should still be socially distancing. And until he says otherwise, I'm gonna follow his lead, and I hope you will too. Thanks.